Have you ever felt tired, even after a full night's sleep? Do you find yourself getting sick more often than you used to? These could be signs that you have a vitamin D deficiency. Here are 14 signs that you may have a vitamin D deficiency. 1. You have a bone or muscle pain that doesn't go away. 2. You feel tired or fatigued all the time. 3. You get sick or infected often. 4. You have a poor appetite, especially for foods that are typically high in vitamin D, like fatty fish and fortified milk. 5. You have bone loss or osteoporosis. 6. You have depression or anxiety. 7. You have trouble sleeping. 8. You have muscle weakness or difficulty walking. 9. You have unexplained hair loss. 10. You have trouble concentrating or remembering things. 11. You have a weakened immune system. 12. You have low levels of calcium in your blood. 13. You have dark skin or live in an area with little sunlight. 14. You are pregnant or breastfeeding. Vitamin D is a vital nutrient that our bodies need for a number of functions, including maintaining strong bones and teeth, boosting our immune system, and regulating our mood. It is also important for regulating calcium and phosphorus levels in the body. So, how do you get vitamin D? Our bodies can produce vitamin D when our skin is exposed to sunlight. However, if you live in an area with limited sunlight, have dark skin, or spend most of your time indoors, you may not be getting enough vitamin D. There are also certain medical conditions, such as Crohn's disease and celiac disease, that can make it difficult for the body to absorb vitamin D. And if you are pregnant or breastfeeding, you may need to increase your vitamin D intake to support the needs of your growing baby. If you think you may have a vitamin D deficiency, there are a few things you can do. 1. Get more sunlight. One of the most effective ways to increase your vitamin D levels is to spend more time in the sun. When your skin is exposed to sunlight, it produces vitamin D. Aim for about 15 to 30 minutes of sunlight on your face, arms, legs, or back without sunscreen a few times a week. Just be sure to use caution and protect your skin from sunburn. 2. Eat more vitamin D-rich foods. There are a few foods that are naturally high in vitamin D, including fatty fish like salmon, mackerel, and sardines, as well as egg yolks and cheese. You can also get vitamin D from fortified foods such as milk, orange juice, and cereals. 3. Take a vitamin D supplement. If you are unable to get enough vitamin D through sunlight and your diet, a supplement may be necessary. Your healthcare provider can recommend the right dosage for you. 4. Get your vitamin D levels checked. If you suspect you have a vitamin D deficiency, it's important to get your levels checked by a healthcare professional. They can recommend the appropriate treatment based on your specific needs. 5. Make lifestyle changes. In addition to the above strategies, there are a few lifestyle changes you can make to improve your vitamin D levels. For example, try to get outside more, especially during the middle of the day when the sun's rays are the strongest. You can also try to reduce your time spent indoors and wear clothing that allows your skin to be exposed to sunlight. If these options aren't enough, your healthcare provider may recommend taking a vitamin D supplement. It's important to speak with a healthcare professional before taking any supplements, as it's possible to have too much vitamin D in your system. In conclusion, vitamin D is an essential nutrient that plays a vital role in our overall health. If you think you may have a deficiency, there are steps you can take to increase your intake and get back on the path to feeling your best.